The secret of Japanese longevity, unlocking nocturnal synovial regeneration. The image of a 92-year-old Japanese woman effortlessly touching her toes is a jarring contrast to mobility struggles faced by many in the West. This difference is not due to genetics or expensive treatments. It is, as the narrative suggests, rooted in a culture of consistent, mindful nightly body maintenance. Researchers at institutions like Tohoku University have purportedly zeroed in on the key: 5 simple movements performed before bed that take just 12 to 15 minutes and dramatically shift the aging process in the joints. The core mechanism is dubbed Nocturnal Synovial Regeneration. This concept suggests that by performing specific movements that increase circulation and decompress the joints right before the body enters its deepest rest phases, we can prime the joints to rebuild and replenish their vital lubricating fluid, synovial fluid, while we sleep. This is a powerful shift from viewing aging as an inevitable decline to seeing it as a process that can be actively supported and reversed with consistency. The 5 movements for nightly joint renewal. These 5 movements, reportedly performed by Japanese elders, follow a logical progression, starting with large muscle groups and connective tissue, moving to the spine, and finishing with the foundational joint of the hips and ankles before the powerful final reset. Move number 5, the seated forward fold Japlish Zen stretch. This movement is the nightly reset button. Focus on lengthening the myofascial lines that run along the back of the body, which become stiff from hours of sitting. The scientific rationale: myofascial release and lumbar relief. The act of slowly folding forward while seated without forcing triggers a myofascial release response. The fascia, the tough, spiderweb-like connective tissue encasing all muscles, becomes rigid with age and tension. By holding the stretch for a sustained period, approximately 3 minutes or 100 breaths, you allow this tissue to soften and reorganize. This profound release in the hamstrings and lower back is critical because tight hamstrings pull on the pelvis, flattening the natural curve of the lower spine, the lumbar lordosis, and leading to chronic back pain. Actionable key: hold a position with a tall spine first, initiating the movement from the hips, not the rounding of the shoulders. The depth of the stretch is less important than the consistency of the hold. The bedtime advantage: performing this as your body temperature naturally dips for sleep makes the muscles and fascia more pliable, maximizing the release effect. The deep breathing during the hold further signals the nervous system to relax, moving the body out of a fight or flight state and into a state conducive to regeneration. Move number 4, the lying spinal twist Japlish Ninja pose. A deceptively simple, relaxed movement performed on the back. The spinal twist works directly to undo the compressive effect of gravity on the discs. The scientific rationale: intervertebral decompression. Throughout the day, the 23 intervertebral discs that cushion the spine lose fluid and are compressed, making people literally shorter by the end of the day. The gentle twisting motion, particularly when the shoulders remain anchored to the floor, creates a form of intervertebral decompression. This subtle pulling apart allows the gel-like nucleus of the discs to redistribute fluid, rehydrating them for the night. This is essential for long-term spinal health. Actionable key: the secret to this movement is breathing into the stretch. By inhaling deeply into the side of the rib cage that is stretched, you use the diaphragm and intercostal muscles to create a dynamic stretch from the inside out, further separating the ribs and vertebrae. The consistency factor: Holding the pose for a minimum of 90 seconds allows the nervous system to fully relinquish control. The benefits accrue not in the first 30 seconds of tension, but in the final minute of relaxation and release. Move number 3, the cat-cow undulation, Japlish Nikoi flow. Returning to the all-fours position, this movement is a key to spinal segmentation and cleansing the central nervous system. The scientific rationale: cerebrospinal fluid circulation. The cat-cow is not just a spine stretch. It's a rhythmic pump of the body's most critical internal fluids. Advanced imaging has shown that this fluid, cerebrospinal fluid CSF, is circulated more efficiently by the wave-like, segmented movement of the spine. CSF bathes the brain and spinal cord, acting as a sewer system that removes metabolic waste products, a process known to be most active during deep sleep. Improved CSF circulation is linked to reduced morning stiffness and less brain fog. Actionable key: the movement must be wave-like and fluid, starting from the tailbone and rippling up through each vertebra to the neck, and then reversing. Japanese elders visualize themselves as seaweed in the ocean to encourage this fluid, non-mechanical quality. The postural benefit: this quadruped position reteaches the spine to move in distinct segments rather than one stiff block, improving overall balance and motor control. The 2-minute duration, about 30 complete cycles, is the optimal time to maximize the CSF pumping action. Move number 2, the ankle and hip circles Japlish K10 movement. This movement targets the 2 bookends of the lower body, which are often completely neglected in general stretching routines, yet are fundamental to movement quality. The scientific rationale: integrated joint health and fall prevention. Ankle circles are a direct countermeasure to the dramatic loss of ankle mobility with age. When the 33 joints in the ankle are restricted, the body compensates by over-twisting the knee and hip, leading to pain and instability. By restoring multidirectional movement in the ankle, you stabilize the foundation, which, in turn, reduces strain on the knees and dramatically lowers the risk of falls, a critical component of independence for seniors. Hip circles are equally important. Walking only moves the hip in one plane, flexion/extension. The slow, gentle circles, 5 in each direction, move the hip joint in all 3 planes of motion, including crucial rotation. This multidirectional movement is necessary to properly stir and distribute the synovial fluid inside the ball and socket joint, ensuring the cartilage remains nourished and resilient. Actionable key: perform these circles slowly and deliberately. The goal is lubrication and range of motion, not speed. A gentle hug of the knee toward the chest before circling the hip enhances the decompression effect. Any clicks or pops without pain are simply the release of accumulated gas or fluid. Move number 1, the wall legs elevation, Japlish Sewage. This is presented as the most powerful and counterintuitive movement, directly triggering the cascade that reportedly leads to increased synovial fluid production. The scientific rationale: lymphatic drainage and spinal rehydration. Lying on your back with your legs up the wall addresses 2 critical age-related problems: systemic inflammation and spinal compression. Lymphatic drainage: the body's lymph system, which clears inflammatory waste, lacks a central pump. Gravity and movement circulate it. When you elevate your legs above your heart, you create a powerful gravitational assist, reportedly increasing lymphatic drainage by up to 95%. This flushes inflammatory compounds and excess fluid, which contributes to nighttime bathroom trips out of the legs and feet, reducing overall systemic inflammation. Spinal decompression. This position gently flattens and lengthens the spine, creating a traction effect that is reportedly enough to open the spaces between the vertebrae by about 2 millimeters. This allows the discs to rapidly rehydrate with fluid, optimizing their cushioning capacity for the next day. Actionable key. The setup is vital. Keep the buttocks about 6 inches from the wall and place a small, folded blanket under the hips to create a slight tilt. Breathe slowly and deeply through the diaphragm. The diaphragm's pumping action is a primary engine for lymphatic flow. The synovial breakthrough. By decompressing the joints, especially the hips and spine, and reducing inflammation right before bed, the body is placed in an optimal state for nocturnal synovial regeneration. The hypothesis is that with less pressure and less inflammatory waste, the body's natural deep sleep restorative processes can be solely focused on replenishing joint lubrication. The philosophy of consistency, nightly body maintenance. The true secret of the Japanese elders is not just the movements themselves, but their approach to them. They do not view this as exercise, but as non-negotiable nightly body maintenance, as essential as brushing their teeth. Comfort over perfection. The use of folded blankets under the sitting bones or a towel under the wrist illustrates a foundational principle. Modify, don't skip. The body needs to feel safe and comfortable to fully release tension. Forcing a stretch triggers the body's protective reflex, which defeats the purpose. The power of consistency. The movements are not about instant change, but about cumulative effect. Showing up for 12 to 15 minutes every night reprograms the nervous system. After weeks, the body trusts the position and the progression, e.g., reaching the ankles instead of the knees in the forward fold, happens naturally, a meditative practice. Turning the movements into a time of reflection, gratitude, or simply focused breathing integrates the mind and body. This meditative quality enhances the nervous system's ability to transition into the restorative mode necessary for deep sleep and cellular repair. By adopting these 5 simple movements, the promise is to shift the narrative of aging from deterioration to renewal, leveraging the body's own powerful regenerative capacity every single night. The change begins tonight on your bedroom floor.